So I've been wanting to get Sculptra for a while, and so today we're going to talk with Gina Jones about sort of what to expect and what a consult actually looks like. So Gina.
Hi. So basically when my clients come in, we kind of go over all the, progression of aging in the face, and a lot of times I want to hear what their issues are and what some of the areas that they feel like need improvement. Where do you feel like you need improvement?
So I see these lines a lot deeper now and a little bit more like just almost like pushed forward is what it looks like, I guess, and just some volume loss here.
And so what she's pointing out is typically exactly every conversation I have with almost everybody. Due to the volume loss that we lose in, our temples, our mid-lateral cheeks, have you turn this way here. This little segment back here even, all affect everything through here. We digress in a V fashion, so when our volume starts to deplete, gravity's pulling, we move this way. So that's why clients are always complaining about his, heavy nasolabial folds, corners of the mouth turning down, and that's kind of what she's saying here, a little bit of this redundancy of tissue here, and then ultimately the jowls kind of take the brunt. So Sculptra is a really great one because it's not a filler, it's not an immediate gratification. We definitely have our normal dermal fillers to kind of take the place of that, but this is a really good product for a natural rejuvenation. It does take some time because it is a stimulant to stimulate your own collagen, which is good, because when I inject it, basically everything that you're left with when everything kind of comes to fruition is your own. It's your own tissue. So common areas that we do is temples, mid and lateral cheeks, and we can even go here a little bit into the jawline as well. Areas we do stay away from: nasolabial folds, no lips, no tear troughs, nothing that there's a lot of muscle contraction, and we need to be in a certain plane to inject this to get that stimulation going. And when that stimulation happens, when temples start to fill out, it will start to raise this lateral brow a lot of times. When we start to get the cheeks in this area, you'll start to notice some offset on that nasolabial fold, even the corners of the mouth, and especially when we get in this little segment here, will help this back area here and kind of lift to give you more of a refined jawline. So it's a great product. It does take about I typically tell people, depending on how depleted they are, where they're starting with, what their baseline is, 2 to 4 sessions, 6 weeks apart. Typically 2 to 3 vials each session. It just depends how much we're needing, how much volume deficit there is. But we inject that, and then you kind of let it simmer. That's basically what I say, because it's kind of like I'm planning fertilization to help stimulate your own body tissue to stimulate the collagen. Once it does that, it takes anywhere, I say 6, 8 months, 12 months to get to that fullness of what people are seeking. It really just depends on how you stimulate your own collagen. Age is a factor sometimes, so it really just depends. But really, a lot of people are starting to notice differences, especially after that second session to the third session. In addition, I find the quality of the skin gets a lot better, a lot brighter, a lot more even. So there's bonuses to that, and I think it's just that overdrive of collagen stimulation that's happening overall. So
how many vials total do you think somebody like me would need?
I feel it's pretty average is 2. I could definitely get 2
per session.
Okay.
2
and then 2 per session, 2 to 4 sessions. So that could potentially 2 to 8 vials, I guess. But once you get to your plateau, which typically takes at least a year, we kind of know where we're at. You definitely have to go on a maintenance because we're constantly aging. So we're constantly depleting our collagen. We constantly need to be stimulating the collagen. So I definitely like to have my clients come back anywhere from 6, 8, 10 months sometimes, just to let me sprinkle a little bit is what I call it. It's not like I never do that whole 8 vials again. It's not going to be that way. We just kind of want to keep you plateaued and keep you, at a steady aging process. So never getting yourself back to baseline. We just want to keep you going. So then we just kind of sprinkle in the areas that we had planned it, and you just keep stimulating as you're depleting. So long-term costs, it can kind of be a little bit easier on your pocketbook, even though the beginning can be a little bit costly at times because you got to kind of get there first. But it is a beautiful rejuvenation.